Good evening and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Dr. Nandita Mohan and let's look into today's reports. Viagra use linked to reduced risk of Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that causes the brain to shrink, that is atrophy, and the brain cells to eventually die out. Alzheimer's disease is the most common cause of dementia and is set to impact 13.8 million people by 2050, underscoring the need for rapid development of prevention and treatment strategies. Drug repurposing use of an existing drug for new therapeutic purposes offers a practical alternative to the costly and time-consuming traditional drug discovery process. A new Cleveland clinic-led study has identified sildenafil, an FDA-approved therapy for erectile dysfunction and pulmonary hypertension, as a promising drug candidate to help and prevent and as well as treat Alzheimer's disease. The Nature Aging Journal findings only establish an association between sildenafil use and reduced incidence of Alzheimer's disease. Researchers are now planning a mechanistic trial and a phase 2 randomized clinical trial to test the causality and confirm sildenafil's clinical benefits for Alzheimer's patients. Varsity effective in severe nail lichen planus, a first case report. Lichen planus is an inflammatory disorder of the skin and mucous membranes. Lichen planus of the nails occurs in approximately 10% of the patients, commonly involves multiple nails and can lead to even scarring of the nail matrix and possible complete loss of the nail plate. Nail lichen planus is a notoriously difficult condition to treat nail disorder with high rates of therapeutic failures or even relapses. Recently, an article describing the use of baricitinib in severe recalcitrant nail lichen planus was published in the Journal of American Academy of Dermatology. A woman in her 60s presented with 1-year history of a severe nail dystrophy of all fingers of both the hands. The genus Kinase 2 is considered the cornerstone of the pathogenesis of lichen planus. Thus, the authors administered baricitinib, an orally highly selective genus kinase half inhibitor, which has a good safety profile resulting in rapid and sustainable improvement without any adverse effects. Prescribing an abortion pill without restrictions found to be safe and effective. The abortion rate is 11.4 abortions per 1,000 women aged 15 to 44 years, and the abortion ratio is 195 abortions per 1,000 live births. A UBC-led study has recently found out that prescribing an abortion pill without restrictions is considered safe and effective. The study, published in the New England Journal of Medicine, suggested that the drug was able to complete a robust safety profile for the entire province by linking together health records from all practitioner visits and hospital visits. The patients with the most comprehensive picture of abortion safety to date, capturing any setting where a complication would present. It demonstrates very clearly that restrictions on the abortion pill are considered safe and are not necessarily doubted for safety. Inadequate folate intake tissue impair repair process in diabetic foot ulcer. A diabetic foot ulcer is an open sore or a wound that occurs in approximately 15% of patients with diabetes and is most commonly located on the bottom of the foot. Individuals with diabetic foot ulcer are required to take adequate nutrition, therefore an assessment of dietary intake plays very crucial. A lack of proper intake of nutrients including protein, zinc, vitamin C and D have all been related to very poor wound healing. However, the comprehensive dietary intake of adults with such a condition is very poorly understood till date. A lack of adequate folate may negatively impact the healing in patients with diabetic foot ulcers, according to a study published in the Journal of Human Nutrition and Dietetics. This implies that wound management of people with diabetic foot ulceration should include a regular assessment of dietary intake in order to recognize the deficiencies in macro as well as the micronutrients of the body. Addressing these inadequacies can help to optimize the healing process. Ultra-processed food directly linked to risk of type 2 diabetes. Over 537 million adults aged 20 to 79 years are living with diabetes these days. This number is predicted to rise to 643 million by 2030 and 783 million by 2045. Consumption of certain food categories have always been increased with risk of diabetes. However, there is no evidence from meta-analysis that assesses the risk of diabetes associated with the intake of ultra-processed food. A new study in the International Journal of Epidemiology has found that eating ultra-processed ultra-processed meals raise the incidence of type 2 diabetes as a dose-response impact with moderate to even high evidence of believability. In conclusion, the data from this study points out that the risk factor of ultra-processed foods and its risk with respect to type 2 diabetes mellitus. Thank you and stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.